This segment sponsored by Viking Psychiatry. You may have heard of something called MTHFR. It's a gene that can affect your mood and your focus. And today on Mental Health Matters, Sean Goddard from Viking Psychiatry is here to break it all down. Good morning, Sean.
Good morning.
Okay, so I haven't heard of this. This is new to me. So what is MTHFR?
Yeah, so, we've done that video in the past in regards to gene testing. And so this is one of those genes that we look at on that gene testing. And MTHFR, to simplify, is how you process folic acid and certain B vitamins and convert them. And you have a deficiency in that conversion. And that creates a lot of different things when it comes to the body, but specifically for the brain, it leads to an underproduction of neurotransmitters such as serotonin, dopamine, GABA, and more, to be honest.
And so you say underproduction, so the underproducing that, could that actually lead to some of these mental health issues like depression and sadness and anxiety because they're not getting those proper bursts of the things that actually make us feel happy and alive?
Yeah, absolutely. It's poorly understood, honestly, in the mental health community, and more time needs to be spent on it so that everybody has an understanding. But there's this whole chain and cascade that occurs. It starts with something as simple called a SAMe that's responsible for creating all these different things, even BDNF, which we talked about before, brain-derived neurotrophic factor, which is like the miracle grow for the brain. And so because of that, one of the things that I tell individuals, and you can have a wide range of severity. You can be mild to severe in your deficiency. And I tell people that really fall into that moderate to severe range. A lot of these people have always felt like something's wrong, right? As long as they can remember, they've always felt like they've been more anxious than most people, or felt sad, or just monotone, right? That they've always felt like something's wrong. And yes, because if methylfolate is the building block for your neurotransmitters and you're deficient on 70% of the building blocks, you have to have those building blocks to make those neurotransmitters. So does it make sense that you would be short on the neurotransmitters because you don't have those building blocks? And we know dopamine is responsible for reward and pleasure, right? And we know GABA is responsible for calming, right? And so if you're short on calming, you're going to be more anxious, right? If you're short on dopamine, you're going to feel less joy and reward. So it absolutely contributes to overall mental health.
So this MTHFR, is this something that our body naturally produces? Is this something that is found in a supplement? Can you tell me like where this even comes from?
Yeah, so folic acid is what we take in, and really we don't talk about it enough. About the only time they talk about folic acid is when? During pregnancy, right? Make sure you take your prenatal vitamin. It's important for the baby, for development and growth and birth defects, and it's very much plays a key role in the nervous system. And so we take folic acid into our diet naturally every single day, right? And it's a core component. Some of us don't get enough because of our diets, right? And so that's why we stress multivitamins among many things. And so it's a natural process. We take it in. Our body brings that folic acid in, but it can't use it as that. It has to break it down and convert it to the methylfolate. And that's what our body uses. And the issue is in the breakdown. As we try to break it down, right, it's like they put somebody in there who was just first day on the job with no training on how to use the equipment, and they're just flying around and destroying that folic acid. And so when it's all said and done, we only get a smaller portion of what we need, which then leads to this whole chain cascade of changes in the body. It's not just mental health. People with MTHFR deficiencies have a higher risk for bleeding and clotting disorders. They have a higher, so for stroke, MS, insomnia, inflammatory disorders, women, higher risk for like endometriosis, PCOS, issues around the cycle. So it's not just mental health that plays a key role in, but mental health is something that we really focus on because there's a lot of people walking around with this deficiency that aren't aware of it.
And so the testing for this, is this something that you offer?
Yeah, it's simple. It's just a simple swab of the mouth. We use 2 different companies, very affordable. In most cases, after insurance, it's anywhere from $2.99 to $3.99, depending on insurance. Sometimes it's less than that, right? They say no more than $2.99 or $3.99. Sometimes it's nothing, depending on your insurance. But it's a simple swab that we send out and get those results back. Now, you have to come in and see us, and we have to do an assessment on you because we have to certify the medical necessity to do this test. But we absolutely do it. And then we specialize in looking at those results because we see these tests being run all the time. I just had a client in my office yesterday who already had gene testing done and had this MTHFR deficiency and also something called a COMT deficiency, and nobody had addressed it with them prior to this point. And so just because they can do the test doesn't mean that you're getting the best outcomes from getting that test done.
Right, and then it's like once the test is done, then what? So you have the capabilities of treating this as well.
Absolutely. Okay. Yeah. The MTHFR deficiency is actually very easy to treat. We just supplement it with methylfolate. So we give you the pre-converted version. So it's not a medication, it's a supplement, right? And we look at your deficiency and how severe, and we tell you about what dose you need to take of that. And that is something that you do have to take for the rest of your life, right? Because you have to keep giving yourself the building blocks every day. But the studies show that within 2 to 3 months of supplementing and treating this, that kind of those neurotransmitters reach their natural reserves or their natural balances, right? And so we can see up to significant improvement in mood, anxiety, irritability, attention, and beyond.
Wow. And so if someone's thinking, okay, maybe I need to take this test, maybe this is a concern, what are symptoms that they should be looking for?
Yeah, I mean, individually, what we really stress with people is if they've struggled with mental health, right, and they've been on maybe a couple medications and they're not really improving or having minimal response, 2 medications failed in depression is considered treatment-resistant depression. But sometimes the reason we're treatment-resistant is because we have that MTHFR. So if they're struggling with mental health issues and not finding that they're responding to traditional treatments, this is something that we're looking at, if not first line, when somebody's failed at least 2 meds, we're saying, okay, we need to look at this and make sure that your genes aren't affecting your outcomes. So.
Okay, well, thank you for this new information. Really appreciate it. Really good stuff. Okay, so understanding your genetics can really open up new doors in treatment. And as you heard, Viking Psychiatry is here to help their patients explore it all. So you can contact them today. Their website is listed below, and we'll be back after this short break. This segment sponsored by Viking Psychiatry.